All right, and we're live, Miss Leighanne. Technology, right? It's always a little
Exactly.
pesky.
Always.
But here we are. So I'm so happy to have you here, Leighanne. Leighanne is the executive director of the West Cancer Foundation, a company and an organization that we at Total Health Oncology partners with a lot. And we are so excited to have her here to share with us what the West Cancer Foundation, what you do. So, Leighanne, I'm going to turn it over to you to introduce yourself and tell us about your work there at West.
Sure, thank you. Again, I'm Leighanne Soden, and with the West Cancer Foundation in Memphis, Tennessee. We are a community-based nonprofit we're very proud of that really makes us unique is that we serve and work with any and all providers or hospital systems. It doesn't matter who the provider is. My board likes to say that we are agnostic in that we don't work with just one single provider.
Okay, all
We
right. And
have a
so I know there's a bit of a delay. Yes, I was gonna say, yeah, continue. Tell us more what you guys do actually in the community out there, because I know Memphis is a very interesting city. So yes.
One thing, two programs we're really emphasizing right now. One is our transportation program, which has grown exponentially over the year over year. And this year already we have served over 2,000 patients,
Oh wow.
2,500 to be exact. And that
Wow.
doesn't include May's numbers. So there is a huge need of transportation. I know you know because you're in the business that transportation is the number one barrier to healthcare across the country, particularly with cancer patients. As we all know, if you're receiving radiation or chemotherapy, you cannot miss one of your appointments. Research shows it affects your outcomes if you miss even one. That program is growing and growing. And the other program that is very important to us that we're working really hard to make sure the community knows we're here is we navigate women to their breast screenings. If they are uninsured
Hmm.
or underinsured, we will pay for that. And we have several partners within the community we work with, providers that the ladies can choose where they'd like to go, the most convenient. Because Memphis is still in the top 10 of the largest cities with morbidity rates for African American women. So
Wow.
we want to get out of that top 10. I want to get us out of the top 50. But we know we've got a lot of work to do there, but we have a lot of resources. We have a lot of community partners that share in our mission to do that. So we're working every day on that. Two other programs we provide, which are very unique because we're the only organization we know of that provides this for anyone. It's the lymphedema
Hmm.
program and the post mastectomy programs. We provide the garments, the prosthesis, the wraps, bandages, whatever is prescribed by the physician. Lymphedema is a horrible, horrible thing. I've never had it, but I've learned a lot about it, and it's painful if you don't have the proper resources. So those are two programs that we're really proud of. They run along smoothly, and we actually inherited the program several years ago, and it's been a great service to a lot of people, not just women. Anyone who's receiving treatment can get lymphedema.
Wow. Alana just, had a note there for you, Alana. She says, thank you for all that you do for the Memphis community. There's no doubt you have saved many lives by providing the services that you do. And, you mentioned, and you're right, you don't want to be in the top 10 of for anything bad, right? And so, but it is what it is for the moment. And imagine if you guys weren't doing that, what you were doing, with the transportation services, and we're looking at disparities in care and these different and this different outcomes, and the factors. The more I talk to guests like yourself, I'm seeing all the social factors, right? Like you said, like transportation, like you're missing your radiation appointments, you're missing your chemotherapy appointment, you're not getting to your breast exam early enough, so you're diagnosed later. And so I am really thankful for organizations such as yourself that is really trying to get these barriers down. Because when you mention transportation, 2,500 you know incidences or needs for this year so far. The people who are calling in for transportation, are they like single moms? Do you have a demographical picture, or is it just majority Black women? What are you showing?
It's a pretty big mix, honestly.
Yeah.
I would say a majority are over the age of 50. And
Okay.
there are some who can't rely on their, like my mother, they may not know how to use text or how to use their phones. So we walk them through the process. We just went with a program called Ride Health in February of this year, and that has allowed us to serve even more patients. Communication is one of the issues that we manage. Hispanic population in Memphis continues to grow, and also Hispanic poverty levels have for the
Oh,
first time exceeded Black poverty levels in Memphis. So we're trying to reach out through different means and partners to that particular community. As far as the screenings, and the transportation, we tell everyone that regardless of what your need is, if it's oncology related at all, screening, follow up, regardless, we're going to help you get there, especially promoting those any types of screenings and breast. But we of course have emphasis on patients in active treatment,
you're right.
make sure they don't miss those radiation appointments. And we've had some wonderful, grateful patients write to us and tell us, I don't know what I would have done if it weren't for West Foundation to help me get to my treatment. I had no one else.
That is amazing. Uh, But you're saying, because Memphis is one of our markets, the Cancer Equity Project, we target Memphis and South Florida. And what you're sharing with us now, at least with me anyway, is Hispanic growth is interesting to me because you think of Memphis and you think, okay, you think African Americans, right? You think the Black population, and I will get with you afterwards, Leighanne, to see if you have any stats that you can share, any numbers, because I'm very curious. Because even as we roll out our programs, we want to make sure that we are sensitive to that population. And you mentioned, barriers like just language.
Mhm.
We want to make sure that we are serving that population at a level that they deserve. There's a question for you here. We know that cancer drugs can be expensive, and often patients will opt to less effective treatment. What kind of assistance do you have from pharma in providing assistance to minority and underserved populations? Interesting question.
Sure. At this time, we don't have a program to provide any type of pharmaceuticals for patients. Now, that being said, we also receive extremely generous support from all the pharma that work with all the different oncologists in the Memphis area. This is something that we're talking about as part of our 3 to 5 year strategic plan, is how can we help on the financial side with providing them, because yes, they are extremely expensive. So that's a goal we're working on, but we're building relationships with all the oncology pharmaceuticals that provide strictly for breast, ovarian, lung, and prostate.
Hmm. The big four, or the big five. So I was just going to ask about funding. So yeah, you're funded by pharma, but and to help you with the transportation and the other services. That even at least that's good. So your 3 to 5 year plan, you said, is to try to offer even more services in terms of financial, which is, I had someone on from another organization last week, and the the largest need has been financial on their call center, right? Because of the cost of the drugs, as Peter mentioned, very expensive. So what do you do now? Do you collaborate? Do you work with other agencies who offer financial services to
We
help
have,
your?
sure, we have resources we can refer patients to if they need something that we can't provide for them. West Cancer Center and Baptist Memorial Healthcare, they offer great programs to help patients. So if it's something we can't do, we have a sort of a resource list where we can help patients to find other resources that are available to them to help them.
How many do you have on your team?
We're at 6 right now, soon to become 8.
Okay, wow. And the team mostly, when it comes to the transportation, are you guys working with a sub, or or does your team, are they the ones to coordinate all these 2,500 people?
Yes, we have one
Wow.
team member. That's pretty much what she does all day. I hear her outside my office every day in her sweet voice, asking, yes, ma'am, tell me where you need to go. And, trying to help some of the patients who just don't understand our language. Sometimes we take for granted, like you and I talk, we say oncology, when we talk about pharmaceuticals and things of that nature. That's some languages they don't even understand. And some instances we ask, what type of cancer, and they don't really know. So there's so much education that needs to happen out there. We are
Yes.
partnering with the University of Memphis, which recently received their R1 designation, Research 1 designation, which is the highest you can get in the country. We're working with their School of Public Health, and they are collaborating with us on some grants that we provide grant funding to them specific to socioeconomic issues around cancer. And they also are starting to now, we're still kind of a baby foundation. This is only our 4th year of operations, but we're starting to be able to provide metrics. And what we want to ultimately do is say that we have made a difference in the 38126 or the 38109 zip codes in Memphis, where we know there's the most extreme poverty. So how can we do that? Keep getting the women in, getting the results, working university, and figuring out what are we doing good, what are we not doing very well, and how can we improve.
Yeah, so it's a lot of record keeping, like you said, right? And the tracking. And I know in the nonprofit world, it's a lot of that to prove effectiveness, right? How many have been served? So what's the follow-up plan? Like, so how do you guys keep track? So for example, the folks who you help to get the mammograms and the screenings and so forth, how do you guys keep track? Do you guys, is it one and done, or, and even with the transportation to treatment, how do you guys keep track to know how effective you guys are being? I mean, we know just the fact that you get them to one screening, that in itself is a success, right? Because without you, that might be delayed until there's an actual activity going on in the body. So, how do you guys follow up, and how do you guys keep track?
With the women that we provide the mammograms for, we ask their permission, of course, very careful about HIPAA and PHI, as we all are. And if we can follow up with them, and if they had a good report, come back in a year, then we add them to our list, a timeline, and we'll call them, 2 months before the 1 year and say, come on, it's time again. If certainly there is an issue, we follow them. We have detected 3 cancers with this program that we started in May of 2021. We don't want to detect cancers, but we want to get more women in, especially those in high risk patients. And again, that's a terminology that a lot of people don't. What does that mean? High risk. We know what it means,
Right.
but it's a lot of education. And one thing on the transportation program, the young lady that does this, she's so delightful. I hear at the end of the day, she calls all of her patients and says, okay, I want to make sure, everything went well today. Your driver was good. You got home on time, anything you need, and, make sure we have you booked for your next appointment. So that's one way we follow with them. And then, of course, all the metrics and data that we're beginning to keep on the patients.
That's awesome. I mean, that woman who you describe on the front lines, I mean, she's a keeper, isn't she?
Yes.
Because just, when we know interactions with any type of facility, right? Especially when you're going through cancer, if you're getting someone on the other end who is not empathetic, right? It just makes it so much harder for you, as with what you're already going through. I have a couple questions for you here, Leighanne. So Peter says, how have initiatives like Medicaid expansion help to expand your services to minority populations in Memphis? Does it affect you in any way, or?
We haven't seen or had any effects so far. One reason that we do the transportation program is because Medicaid does help with transportation, but you have to book so far out in advance, and patients don't always know when they need to go. So that has affected us in helping more patients because it's not as reliable as we are sitting right here in Memphis, working with the patient one-on-one. But right now, I don't know I can't give you any facts and figures on the expansion of Medicaid and how it's affected us. I know one thing that has really affected us is Susan G. Coleman, of course, who we all love and respect, and they used to be a great partner with us. Their local offices left Memphis, and they left a pretty big void in the community. They funded a lot of programs, a lot of smaller nonprofits that was their only source of funding for their breast cancer programs. So we're trying to follow their excellent example and fill that void. With our foundation, what my board of directors wants to do is don't duplicate services, because there are a lot of wonderful organizations here, but fill the voids and break the barriers. Our tagline is breaking barriers to cancer care in what we're doing.
That's good advice, not to duplicate, because what's the point of that, right? But to more collaborate and partner and see, where the voids are. Sarah said, Leighanne, what I love about you is that you are so committed to your neighborhood, meaning you know who you are and who you can best serve, changing lives.
Yes.
And that's good. How long have you been in that neighborhood? Are you Memphis? Are you from Memphis, or?
I've been in Memphis for over 30 years. And I grew up in Alabama, so
you know your community.
I do. I really do. And I've been in nonprofit oncology work for over 20 years, the last 11 being with West.
Awesome. How do you get the message about your resources out to the community? Do you have any community outreach programs? That was another question.
Yes, absolutely. Rachel Brown manages all of our outreach. She oversees and manages all the programs. And she is doing a lot of different things, some grassroots, boots on the ground, and then other campaigns. We're working with our advertising agency on some campaigns, because what we do, if we can't get the women to their screening, then what are we doing? So we're doing a lot of studying with the University of Memphis, looking again at zip codes and looking at statistics. And of course, we have wonderful breast cancer oncologists that we work with. Dr. Gregory Vidal is actually, he isn't on our board, but he is our scientific advisor for breast cancer. And we always, go to him when we need someone to speak, or when we need him to clarify something, or a quote for a press release. He's been wonderful, and he understands the community even much better than I do breast cancer.
Yeah, he's a very delightful man. I met him earlier this year in Memphis, for sure. Great resource for sure. So as we come to the close, of the talk, I want to ask you something as an executive director. What is your pressing need, or what's on the top of your wish list right now for your nonprofit?
The top is to really increase the screening program. And we do have some marketing funds, but we're a small, young nonprofit. So we really need more community partners. We have great community partners like Church Health Center, Cross Community, the Muslim Clinic, and the Catholic Charities. But we need more and more partners that that want to be our partners. Don't see us as any competition. And
right.
That's a huge need that we have. And so far we've had a lot of luck, but we were 2 people when we started 3 years ago, and now we're at 6. So we're growing and trying to meet that need.
Awesome. When you mentioned Church Health Center, I met Jenny, I think her name is, from the Church Health Center in March as well. How do you guys work together?
They serve as a referral source for all of our programs.
Gotcha. All right.
Patients, if they need us, they send them to us.